This is Charter Local Edition. My name is Brad Pomerance on a road show. I love our road shows. We are actually inside the City County Administration Building in Stanislaus County. We are joined by our host. His name is Stan Risen. He is the CEO of Stanislaus County. Basically, the city seat is in Modesto, to give you a sense of where we are. Beautiful Central Valley. I want to speak with you, sir. Thanks for joining us.
Oh, happy.
About a program you've had for a little while. I remember we spoke about it recently. It's known as your Focus on Prevention program. Tell us about it, sir.
Yeah, Focus on Prevention is a long-term movement that is multi-sector. We're trying to engage 10 sectors of our community in trying to improve the quality of life for all residents in Stanislaus County by improving our emphasis on dealing with root causes and some of the preventive stuff we can be doing rather than always trying to treat symptoms on the backside.
And I want to talk about that because, look, those three words mean so much, and I understand where you're coming from. Just so we can be clear, what's a symptom? What's a root cause?
Yeah, well, it's interesting. I think last time we were together, I shared with you some statistics of fatherlessness. You know, 43% of children in the United States live without a father in the home. But when you look at the impacts, 63% of youth suicides come from fatherless homes. 85% of incarcerated youth came from a fatherless home.
So the root cause is fatherlessness.
Well,
the symptom is suicide, crime.
Exactly. And just the general breakdown in the family. And so a big portion of our effort is going to be what can we do to strengthen families and come alongside families to create healthier environments.
And what I found interesting and notable is that within the program, you, the drafters of this, I'll call it, position paper, have said government is not the answer.
Yeah.
It's part of the solution, but not the only solution provider. And so that's why you have 10 different industries, like you said, that are getting involved.
We are convinced that unless we involve all the sectors of our community, we're not going to see the level of transformation. You know, I've been in government almost 29 years now, and I came into government thinking that government was not the answer, and I'm more convinced than ever after 29 years that government can be an important part of the answer, but if we're really going to see the change we want, the entire community has to embrace it.
But at a certain level, I must say, as someone who covers government, it's good to hear the notion that government's part of the solution. Because
absolutely.
So often, it's very kind of in vogue to bash government and government get out. And yes, look, we're all, we want to be able to run our lives without government intervention, but government can play a part.
And I think one of our roles can be the convener of the community. We know so many people, we interact with so many people, and it's been exciting to see as we've reached out with our vision of Focus on Prevention, how key community influencers from all 10 sectors have responded to the call and have shown up. And we're talking CEOs and leaders of major businesses in county that have devoted enormous hours to this effort.
I want to talk about one element, if I may, of this plan, and it focuses on homelessness, which is one of the symptoms that you're looking to resolve. And I have seen statistics recently, sir, that are heartbreaking. The United States Department of Housing and Urban Development recently issued a report. This is stunning to me. The United States has 12%, I should say it again, California is 12% of the United States population, but 21% of our nation's homeless population are in California.
Right.
I don't even know what to say. This is California. We're supposed to be the golden state. I mean, one could argue that's part of the problem. Our good weather attracts, but what's going on, sir?
Well, I think there are a number of drivers, not the least of which is lack of affordable housing.
Right.
We were the heart of the foreclosure during the Great Recession.
Here in the Central Valley.
Estimated that Stanislaus County probably has in excess of 21,000 units short when it comes to affordable housing units. But I think it's also some of as we talked about, the breakdown in the family, the lack of education. I think there are a number of contributing factors.
You've heard this before. The California Legislative Analyst's Office did a report recently on housing. So California homes cost, on average, $440,000, which is 2.5 times greater than the national average. And then when you look at the number of units we need about 250,000 new units every year in California, and we're building maybe 125,000.
Yeah.
The crisis is acute and chronic simultaneously.
Right, and that's just in the, when you look at home ownership, but when you look at spending power on rental units, I think I saw some statistics recently that since the Great Recession, rents have increased the gap to income by over 15%, so 15% less purchasing power.
And what's happening here in Stanislaus County? Because, amen, this county's coming out of the recession, but it's slow going.
Right.
And we have the drought in the background, and the county has seen some rain, more than Southern California. So many factors involved.
Well, one of the exciting things happening in Stanislaus County is that one of the first efforts as part of Focus on Prevention, we put together a homeless action council. We've had over 100 different individuals participate in our homeless action council and trying to develop a plan about how we're going to tackle this particular challenge. We held a summit called Finding Our Way Home. Summit on Homelessness, had over 500 community residents participate in a day-long event where we worked on vetting strategies about how we're going to address our homeless challenge.
What are you hearing?
Well, probably the biggest single thing is that there are a lot of good people doing a lot of good things, but everybody's working in their silos.
Right.
And we're recognizing the need to create a coordinated access system where we're bringing everybody together and we're creating one system instead of 100 different systems. So it involves common screening, trying to develop a coordinated access site, learning to coordinate supportive services. But perhaps one of the most powerful things to me is during our summit, we had 8 people with lived experience with homelessness share their story. And
they're not what you'd think.
Right.
That is, I mean, I jumped the gun, but I am sure these are not the folks that you'd expect to see on the corner.
Yep. Everyone has their own story, and they don't always fit our neat little stereotypes of, well, these are just substance abuse folks. Yeah,
mental
there
illness.
were issues, but the most powerful thing that came out of that to me, and what we have in our strategy that I see missing in a lot of the rest of the country, is in almost every one of their stories, it wasn't a program or service that helped make a change in their life. It was the engagement of someone who took an interest in their life. We had one lady who was living in the graveyards because she felt it would be safe.
Literally.
People would leave her alone in the graveyard. We had a mental health clinician go to her day after day after day and try to build trust with her in a relationship where she finally reached out for services. And here she was in front of 500 people sharing her story about how she now is no longer in that state of homelessness.
I'm glad you brought up mental illness, because mental illness is so often a driver, not just in homelessness, but in crime, in recidivism. The challenge, and essentially you said it, so many folks are wary of intervention. They may feel as if they all of a sudden enter the system, they'll be trapped. They're service resistant. Mm-hmm. I'd love to hear why, if you know that in that instance, the social work was able to break through, and how do we continue that pattern of success?
Well, I think first of all, it's changing our approach from those who are wanting to reach out to one of empathy, one of respect, one of dignity, and one of personal concern. And once you build that relationship, I think the other key is going to them and instead of always expecting them to come to us. And so part of our strategy is to create engagement teams and entire teams where maybe we have a mental health clinician teamed up with a nurse, teamed up with a community neighborhood member.
Faith leader, maybe.
A faith leader. And reaching out to them.
I want to thank you for joining us, and thank you for what you're doing for the people of Stanislaus County, where we are today on our roadshow. He is Stan Risen, CEO of Stanislaus County. I'm Brad Pomerance, Charter Local Edition.